Picture this. Your mom, your dad, or maybe even you feel exhausted all the time, forgetting names, misplacing keys, and struggling to remember conversations from earlier in the day. It is frustrating, right? And then one day, out of nowhere, you start feeling unsteady on your feet. Walking feels different, almost unnatural. At first you think it is just aging, maybe a little stress. But what if it is something else, something entirely preventable? Vitamin B12 deficiency is a silent problem that can mimic aging and even dementia. The worst part, many doctors overlook it. If caught early, it is easy to fix, but if ignored, it can lead to irreversible nerve damage. That is why understanding this now could be life-changing for you or someone you love. So here is the deal. Vitamin B12 is like the fuel your brain and body need to function. But as we age, our ability to absorb it declines. And that is when problems start creeping in. Now, imagine a car running low on gas. It sputters, struggles, and eventually shuts down. That is what happens to your body without enough B12. Your energy drops, your brain slows down, and even simple tasks feel exhausting. Studies show that anywhere from 3% to 40% of older adults have low B12 levels. That is a massive number, yet many people have no idea they are running on empty. Why? Because these symptoms are often brushed off as normal aging. A little forgetfulness here, a little fatigue there, maybe some tingling in the hands and feet. It is easy to dismiss until it becomes severe. That is why B12 deficiency is so dangerous. It sneaks up on you, and by the time it is diagnosed, damage may already be done. Now, here is the part that might frustrate you. Many doctors do not routinely check for B12 levels. Unless you ask, it might not even cross their mind. That means thousands of people, maybe even you or someone you love, are walking around right now with undiagnosed B12 deficiency. The good news? It is entirely preventable, but you have to know what to look for. And that is exactly what we are going to break down in this video. So, why do older adults struggle with B12 deficiency? Why does this become such a huge issue as we age? You might be thinking, well, I eat meat, I should be fine, right? But here is the truth. Even if you are eating all the right foods, your body might not be absorbing B12 properly. And that is where things get tricky. The number one reason for B12 deficiency in older adults? Reduced stomach acid. See, your stomach produces acid to help break down food and extract B12, but as you get older, your stomach lining thins out. This is called atrophic gastritis, and it affects about 10 to 30% of people over 60. When your stomach is not producing enough acid, it cannot pull B12 from food properly. So even if you are eating steak, eggs, and dairy, your body is just not absorbing the vitamin the way it used to. Then we have medications. And this is a big one. A lot of people take proton pump inhibitors or antacids for acid reflux. These drugs, while effective for heartburn, actually reduce stomach acid. And if you are thinking, wait, didn't you just say we need stomach acid to absorb B12? Yes, that is exactly the problem. These medications make it even harder for your body to extract B12 from food. And then there is metformin, a common medication for diabetes which also interferes with B12 absorption. Another major cause? Dietary choices. If you are vegan or vegetarian, you have to be extra careful about your B12 intake. B12 is found naturally in animal products like meat, dairy, and eggs. It is not found in plants. Now, some cereals and plant-based milks are fortified with B12, but if you are not being intentional about getting enough, you are at serious risk of deficiency. And here is something you might not have thought about: alcohol and smoking. Heavy alcohol consumption can damage the stomach lining, making it harder to absorb nutrients, including B12. Smoking, on the other hand, can reduce the effectiveness of B12 in the body, so if you drink frequently or smoke, your risk of deficiency goes up even more. Then we have people who have had gastrointestinal surgeries. If you have had weight loss surgery or surgery to remove part of your stomach or intestines, your body might not be able to absorb B12 properly at all. This is because a special protein called intrinsic factor, which is made in the stomach, is needed to help B12 get absorbed in the small intestine. If your stomach is damaged or removed, you may not be producing enough of this intrinsic factor, leading to a deficiency. Let's talk numbers for a second. Studies show that anywhere from 10 to 15% of people over 60 have a B12 deficiency that is significant enough to cause symptoms. And among people who have had gastric bypass or other stomach surgeries, that number jumps to as high as 30 to 40%. That is a staggering percentage of people walking around with a deficiency and not even realizing it. But here is where it gets even more concerning. Unlike some vitamin deficiencies that show up quickly, B12 deficiency takes time. Your body actually stores B12 in the liver, and it can take months or even years for your levels to drop low enough to cause noticeable symptoms. That means you could have a problem developing right now and not even know it until years down the road. Think about that for a second. If you are over 60, taking medications like metformin or acid reducers, or if you are on a plant-based diet, there is a real chance that your B12 levels are not where they should be. And that is why awareness is so important. If you know the risk factors, you can take steps to prevent this before it becomes a bigger issue. So let's recap. Why are older adults more at risk for B12 deficiency? Number 1, their stomach acid decreases, which makes absorption harder. Number 2, medications like antacids and metformin block absorption. Number 3, diet plays a huge role, especially if you are vegan or vegetarian. Number 4, alcohol and smoking interfere with B12 levels. And number 5, past surgeries or conditions like Crohn's disease can make absorption nearly impossible. The takeaway? Just because you eat well does not mean you are safe. And the scary part? Many doctors do not think to check for B12 deficiency unless you ask. That is why it is so important to be aware of these risk factors and advocate for yourself, because the earlier you catch it, the easier it is to fix. Now, let's talk about something really important, the symptoms of B12 deficiency. And here is where things get tricky, because B12 deficiency does not show up overnight. It sneaks in slowly, sometimes over months or even years. And the symptoms? They can look like a lot of other things. Think about it. Have you ever had a day where you just felt exhausted for no reason, like you slept well but you still feel drained? Or maybe you have had moments where your memory was just not as sharp as it used to be. You walk into a room and completely forget why you are there. You misplaced your keys, forget a name, or struggle to recall something you were just talking about. Sound familiar? Now, most people brush these things off as aging, but what if it is not? What if it is something you can fix? Let us start with fatigue. This is one of the earliest and most common signs of B12 deficiency. People often describe it as feeling sluggish, like they are running on empty all the time. No matter how much rest they get, they just do not feel refreshed. That is because B12 is crucial for making red blood cells, which carry oxygen throughout your body. When you are low on B12, your red blood cell count drops, and your body does not get the oxygen it needs. The result? You feel exhausted. And then there is memory loss and brain fog. Some people start forgetting simple things. They struggle to concentrate, feel mentally slow, or have trouble processing information. In severe cases, low B12 levels can even lead to symptoms that mimic dementia. Imagine how terrifying that must be. A doctor tells you that your memory issues might be the beginning of Alzheimer's, but in reality, it is just a vitamin deficiency. This is why catching it early is so important. Another big symptom? Tingling and numbness in the hands and feet. Have you ever felt that weird pins and needles sensation when your foot falls asleep? Now imagine that feeling happening randomly, even when you have not been sitting in an awkward position. That is because B12 is essential for nerve health. When levels drop too low, nerves start to misfire, causing numbness, tingling, or even burning sensations. Left untreated, this nerve damage can become permanent. Let's talk about balance and mobility. Many older adults with B12 deficiency start feeling unsteady on their feet. They stumble more often, feel dizzy, or even have trouble walking. Some might chalk it up to aging, but B12 plays a critical role in maintaining coordination and muscle function. Studies show that older adults with low B12 levels are at a much higher risk of falling, and for seniors, a bad fall can be life-changing. Then there are mood changes and depression. B12 is not just about energy and nerves. It is also vital for brain chemistry. Low levels have been linked to increased rates of anxiety, depression, and even mood swings. If you or someone you love has been feeling down, irritable, or more anxious than usual, it might not just be life stress. It could be B12 deficiency messing with brain function. Pale skin and shortness of breath are also common signs. Because B12 is needed to make red blood cells, a deficiency can lead to anemia. When that happens, you might notice that your skin looks paler than usual. You might also feel breathless, even when doing simple tasks like walking up the stairs. Your heart has to work harder to pump oxygen when you are low on red blood cells, and that can leave you feeling weak and dizzy. And here is something you might not have heard before: vision problems. Severe B12 deficiency can actually affect the optic nerve, leading to blurry vision or even vision loss. It is rare, but it happens. And just like nerve damage in the hands and feet, vision loss from B12 deficiency can become permanent if it is not treated in time. So, let's recap. The top symptoms of B12 deficiency include fatigue, memory loss, nerve problems like tingling or numbness, balance issues, mood changes, pale skin, shortness of breath, and even vision problems. The problem is that all of these symptoms can be mistaken for something else. Fatigue? That could be stress. Memory problems? People assume it is just aging. Depression? They think it is just life circumstances. Even doctors miss this diagnosis because these symptoms do not always show up in blood work immediately. And that is exactly why awareness is so important. If you or someone you love has any of these symptoms, it is worth getting checked. Because if caught early, B12 deficiency is one of the easiest problems to fix. A simple supplement or dietary change could completely turn things around. But if ignored, it can lead to permanent nerve damage, long-term cognitive decline, and a lower quality of life. So here is what I want you to do. Take a second and think. Do any of these symptoms sound familiar? Have you noticed them in yourself or in someone close to you? If so, do not wait. Talk to a doctor, get your B12 levels checked, and take action before the damage becomes permanent. Because knowledge is power, and taking charge of your health starts with awareness. Alright, so you have heard about the symptoms, and maybe you are even starting to wonder, could this be me? Could this be my parent? If you are feeling that way, the next logical step is to figure out how to diagnose B12 deficiency. Because the truth is, if you do not check for it, you will never know. Now, here is something most people do not realize. Standard blood tests do not always include B12 levels. Many doctors will only check if they suspect a deficiency, which, as we talked about earlier, is rare because B12 symptoms are so easy to mistake for other conditions. That is why you need to ask for the right tests. So, what tests should you get? The first and most basic is a serum B12 test. This measures the amount of B12 in your blood. Seems simple enough, right? But here is the catch. The normal range is broad, and many people who are technically within the normal range may still have symptoms. Most labs consider levels below 200 picograms per milliliter as a deficiency, but here is the thing. People can have symptoms even when their levels are between 200 and 400, which is considered low normal. That is why some doctors recommend additional testing, especially if symptoms are present. The second test you should know about is methylmalonic acid, or MMA. This one is important because it can detect early B12 deficiency before it even shows up on a standard blood test. When your body does not have enough B12, MMA levels rise. So, if your B12 test comes back normal, but you still have symptoms, checking MMA can help confirm whether you actually have a deficiency. Another test that can be helpful is homocysteine levels. Homocysteine is an amino acid in your blood, and when B12 is low, homocysteine levels go up. This test is not as commonly ordered, but it can provide another piece of the puzzle, especially if you have cardiovascular risks or neurological symptoms. Finally, there is a test for intrinsic factor antibodies. This one checks for a condition called pernicious anemia, an autoimmune disorder that prevents the body from properly absorbing B12. If you have pernicious anemia, you will need ongoing B12 supplementation because your body simply cannot absorb it from food. So let's put this all together. If you suspect B12 deficiency, ask for these tests: serum B12, MMA, homocysteine, and if needed, intrinsic factor antibodies. And do not settle for your levels are normal if you still have symptoms. You deserve a thorough investigation. Here is the bottom line. If you or someone you love has unexplained fatigue, memory issues, nerve problems, or balance issues, do not wait. Talk to your doctor, ask for these tests, and make sure B12 is not the missing piece of the puzzle, because if it is, catching it early can make all the difference in your long-term health. Alright, so now that we know how to diagnose B12 deficiency, let's talk about something even more important: how to treat it. Because here is the good news. Unlike some health conditions that are complicated to fix, B12 deficiency is one of the easiest to treat. The key is knowing how to do it right. First, let's start with the most common approach: B12 supplements. These are widely available, affordable, and can be taken daily. But here is something important to know. The typical multivitamin contains only a small amount of B12, often just enough to meet the minimum daily requirement. For someone with a deficiency, that is usually not enough. If you are low on B12, you need higher doses, typically between 1,000 and 2,000 micrograms per day. That might sound like a lot, but do not worry. B12 is water-soluble, which means your body will take what it needs and flush out the rest. Then there are B12 injections. These are often recommended for people with severe deficiency or for those who have absorption problems. Injections deliver B12 directly into the muscle, bypassing the digestive system entirely. This makes them a great option for people with pernicious anemia or those who have had stomach or intestinal surgery. Typically, injections are given weekly at first, then spaced out once levels improve. Now you might be wondering, which one is better, pills or injections? The answer depends on your situation. For many people, high-dose oral B12 works just as well as injections. Studies have shown that, even in cases of absorption issues, large doses of oral B12, like 1,000 or 2,000 micrograms per day, can still be effective. That is because a small percentage of B12 can still be absorbed passively, even if your body is struggling with the normal absorption process. There is also another option, sublingual B12, which comes in the form of dissolvable tablets or liquid drops that you place under your tongue. Some people prefer this method because it allows for absorption directly into the bloodstream through the mucous membranes in the mouth. While research shows that high-dose oral B12 is just as effective, some people find sublingual B12 easier to take and notice faster results. So how long does it take to see improvements once you start treatment? Well, that depends on how severe your deficiency is. Many people start to feel better within a few weeks. Their energy levels improve, their brain fog clears, and their nerve symptoms start to subside. However, for those who have had long-term B12 deficiency, especially with nerve damage, it can take months to see full recovery. That is why early detection is so important. The sooner you catch it, the easier it is to reverse the effects. Now, let's talk about maintaining healthy B12 levels long-term. If you had a deficiency once, you are at risk of developing it again, so regular monitoring is key. Your doctor may recommend checking your B12 levels every few months to make sure they stay within a healthy range. And let's not forget about food sources of B12. While supplements are a great way to boost levels quickly, it is still important to get B12 from your diet when possible. The best sources include meat, fish, eggs, and dairy products. For vegetarians and vegans, the best options are fortified foods like plant-based milk, cereals, and nutritional yeast. But remember, if your deficiency was caused by absorption issues, food alone will not be enough. You will likely need ongoing supplementation, whether that is in the form of high-dose pills, sublingual B12, or periodic injections. So, to sum it all up, there are three main ways to treat B12 deficiency. 1. High-dose oral supplements 1 to 2,000 micrograms per day. 2. B12 injections for severe cases or absorption issues. 3. Sublingual B12 as an alternative to pills. And the best part? B12 supplementation is safe and effective and can make a huge difference in your energy, brain function, and overall health. Now, let me leave you with this thought. Imagine someone, maybe a loved one, maybe even you, who has been feeling tired, forgetful, or struggling with balance for years. They have seen doctors and tried different medications, but nothing has helped. Then, they get tested for B12 deficiency, start supplementation, and within weeks, they feel like a whole new person. That is how powerful this vitamin is. And the best part? It is completely within your control. You can take action today. So now that we know how to treat B12 deficiency, let's talk about something even more important: how to prevent it. Because here is the thing: if you have had a B12 deficiency once, you are at risk of developing it again, and for many people, it can creep up without warning. But the good news? Prevention is simple, and today we are going to break it all down. First, let's talk about who is most at risk. If you are over 60, your stomach's ability to absorb B12 has already started to decline. That is just a natural part of aging. If you take certain medications like proton pump inhibitors for acid reflux or metformin for diabetes, you are even more at risk. And if you follow a vegetarian or vegan diet, you need to be extra cautious because plant-based foods do not naturally contain B12. So what can you do to stay ahead of this? First, diet matters. The best sources of B12 come from animal products: meat, fish, eggs, and dairy. If you eat these foods regularly, you are probably getting some B12. But here is the thing: getting enough from food alone is not always reliable, especially as you get older. That is why many experts recommend supplementing with B12, even if you eat a well-balanced diet. Now, you might be wondering, if I eat meat, why would I need a supplement? Here is why. As we talked about earlier, your body needs stomach acid and intrinsic factors to absorb B12 properly. But as you age, your stomach acid naturally decreases. So even if you are eating steak and eggs, your body might not be absorbing the B12 efficiently. That is why many older adults still develop a deficiency, even with a diet that includes meat. The simplest and safest solution? A daily B12 supplement. High-dose B12 tablets, 1,000 to 2,000 micrograms per day, are an easy way to keep your levels stable. They are inexpensive, widely available, and effective. If you prefer, you can also use sublingual B12, which dissolves under your tongue and absorbs directly into your bloodstream. For those with severe absorption issues, like people with pernicious anemia or those who have had stomach surgery, B12 injections might be necessary. These deliver B12 directly into the muscle, bypassing the digestive system. If you've had a severe deficiency in the past, talk to your doctor about whether injections might be the right choice for long-term prevention. Now, here is something a lot of people overlook: getting tested regularly. If you are over 60 taking medications that interfere with B12 or have a history of deficiency, it is a good idea to check your B12 levels at least once a year. A simple blood test can tell you if you are falling into the danger zone before symptoms even appear. And let's not forget lifestyle factors. If you drink alcohol frequently, it can damage the lining of your stomach and reduce B12 absorption. Smoking can also interfere with how your body uses B12. If you are serious about preventing a deficiency, cutting back on alcohol and quitting smoking can make a big difference. So, let's recap the best ways to prevent B12 deficiency. 1. Eat B12-rich foods like meat, eggs, dairy, and fish. 2. Take a daily supplement if you are at risk. 3. Consider B12 injections if you have absorption issues. 4. Get your levels tested annually to catch problems early. 5. Limit alcohol and avoid smoking to protect your body's ability to absorb B12. And here is the most important part. Do not wait until you feel symptoms to take action. B12 deficiency develops slowly, and by the time you start feeling tired, foggy, or weak, your levels may have already been low for months or even years. Prevention is always easier than treatment. Now let me leave you with this thought. Imagine someone in their 70s, let's call him John. He is active and independent and loves spending time with his grandkids. But over the last few years, he has been feeling more and more drained. His memory is slipping, and he is not as steady on his feet as he used to be. His doctor tells him it is just aging. But what if it is not? What if one simple blood test and a daily supplement could bring back his energy, his focus, and his quality of life? That is the power of prevention, and that is why taking action now matters. Now, let's talk about some of the biggest myths surrounding B12 deficiency. Because even though this issue is common, there is still a lot of confusion out there, and unfortunately, some of these myths prevent people from getting the help they need. The first myth? I eat a lot of meat, so I cannot be B12 deficient. This one comes up a lot. And while it is true that B12 is found in animal products, the real issue is absorption, not just intake. As we age, our stomachs produce less acid, making it harder to extract B12 from food. So even if you are eating steak, eggs, and dairy every day, your body might not be absorbing enough. The second myth? Only vegans and vegetarians get B12 deficiency. While plant-based diets do increase the risk of deficiency, many meat eaters also develop low B12 levels due to poor absorption. This is especially true for older adults, people taking certain medications, and those with digestive conditions. Another common myth? I do not have anemia, so my B12 must be fine. The reality is that you can be severely B12 deficient without anemia. Many people assume that if they are not anemic, their B12 levels are normal. However, B12 deficiency affects the nervous system long before it causes anemia. That means symptoms like fatigue, memory loss, and tingling in the hands and feet can show up even if your blood work looks okay. So what is the takeaway here? Do not assume you are safe just because you eat meat. Do not assume that only vegans are at risk. And most importantly, do not wait until anemia develops to take action. If you have symptoms, get tested. Because the sooner you catch B12 deficiency, the easier it is to fix. Let me tell you a story. Meet Mary. She is 75 years old, loves gardening, and has always been sharp as a tack. But over the last year, something changed. At first, it was small things, forgetting appointments, feeling unusually tired, and struggling to keep up with conversations. She brushed it off as normal aging. But then, things got worse. She started feeling numbness in her hands and feet. Walking became difficult, almost like she could not trust her own legs. Her family grew concerned, and her doctor ran several tests, checking her heart, her thyroid, and even screening for dementia. Everything came back normal. But Mary was not fine. She was frustrated, scared, and confused. Then one day, a different doctor suggested a simple test: her B12 levels. And guess what? They were dangerously low. No one had checked before because she did not have anemia. Within a few weeks of treatment, her energy returned. Her thinking became clearer, and even the numbness in her hands improved. Mary's story is not unique. Thousands of people, especially older adults, experience the same thing. They suffer from unexplained symptoms for years, going from doctor to doctor with no answers. But sometimes the solution is simple. One vitamin, one test, and their whole lives can change. So here is the takeaway. If you or someone you love is struggling with unexplained fatigue, memory loss, or nerve issues, do not ignore it. Ask about B12. It might just be the missing piece that changes everything. Think about it. How many people are out there, suffering, being told their symptoms are just part of getting older? How many could feel better with something as simple as a vitamin? Margaret was lucky. She got the right test at the right time. Now it is your turn to take control of your health or help someone you love do the same. Do not wait. If you or someone you love is over 60 and constantly tired, forgetful, or struggling with balance, get tested for B12 deficiency. It is one of the easiest health issues to fix, but only if you catch it early. Talk to your doctor, ask for the right tests, and take action today. And if this video helped you, share it with someone who might need it. Knowledge is power, and sometimes one simple piece of information can change a life. Subscribe for more science-backed health tips, and let's keep learning together. Your health is in your hands.